VC, the academic registrar, and different faculties from different universities. I'm called Christas Atukwase, and I'm here on behalf of the Association of Graduate Nurses and Midwives Uganda, who are behind the organization of this quiz, mainly the question bit. HNMU has, I know most of you may be or may not be aware, but is the professional body that unites us as professionals at graduate level up to the doctorate level or PhD level. So it's the neutral ground microphone. That I will speak directly to the quiz so that we get the guidelines for today. So that's the Inter-University Nurses and Midwives National Quiz 2025 program, where champions are made. We are proud that you are all here to be the 2025 national champions for our profession. I'm talking on behalf of the president, who is Professor Komakech. Shout out to the people from LIDA, where he's the head of department, if I'm right. He doubles as the president of the association. He's not been able to make it, but he said since the general secretary, who is me, is on ground, you can take charge. And of course, I didn't come alone. I also came with Sanon. So he is the PRO. You can stand up for recognition, public relations. So I'm also here with a team of judges, where we have the quiz master who was selected this morning. Then we have the judges. You can stand up, please, for recognition. Thank you very much. So they will be assisting us to ensure the integrity of the quiz. We've discussed a lot of procedures. So key things that we came up with are here. Most of you wanted to have these guidelines before, but we had to be in touch with you so that we are in unison with the guidelines. So note that this quiz has both multiple choice questions and short answer questions. I'm speaking to the champions. Can you hear me? Okay. The standard of the quiz has been set as 2 applied skills questions, 2 questions to assess knowledge retention, and 1 question to check teamwork. So we will see as we proceed. Then the rules for the quiz competition. These are not my rules. These are the rules which have been set today morning and agreed upon by the faculties. Are we together? So it's not a one-man show. For us, we've said we are the association of professionals, professional nurses. We just work with you to make sure that you have a neutral ground where you can achieve this. So each university is to present a maximum of 5 active participants per course unit, and the other 5 non-active participants at a time. So in total, they will be 10, but on stage, you will need 5 for each course unit. Who will answer? So you can change them on another course unit, depending on how you know your students. Then the next one, each university will have a team lead who is going to randomly pick the set of questions they are going to answer. So we have numbers written on the sets. You'll come and choose randomly. You will be able to pick the set you are going to answer. It's you to choose your set. And then we'll be calling you according to the availability of the set you've chosen. Then, in any number, that one I think I explained it already. Any number of 5 participants can be on the podium to attempt the quizzes at a time and are allowed to change participants in subsequent rounds. In this round, each team will be asked a quote of at least 5 questions. So in other words, there are 5 questions for each team. Each set has 5 questions for each university. One university at a time to face the panel. So the quiz master, who is Nasif, yes, Mr. Nasif, is going to kickstart, because as we selected him, he's going to kickstart, and then the timer. Yes, thank you. So you have 1 minute to answer the question. That's the agreed time, especially because of the AI. So 1 minute to answer a question. And then the quiz master will request the technical team to display the right answer. And then, if you delay to answer and your time is up, then you lose a point. If you answer correctly, you get a point. You answer wrongly, it's a 0. The team members can discuss before answering. Make sure if you want to pass an idea, pass it within 60 seconds. Am I talking to the champions? But don't press an idea from the back. That calls for cancellation. People who are answering quizzes or questions are here. Are we together? They selected 5. So each university, I believe you've registered the people who are going to do what? To answer. We need the list so that we can confirm. Then, there is no negative marking for wrong answers. So in the case of a tie, for the top 3, so the tie teams get into a tie round. So the rules are similar to round 1. And there is no forwarding questions to the next institution. So you answer right, you get a point. You don't get a point. So this was by HNMU and inter-university stakeholders meeting held on 11th, which is today morning of April 2025. So those are the guidelines of the quiz. Thank you very much. And I am happy that we've had Winnie talk about us, about our attitude. So here we are going to test the skills. Then we can also work on our attitude. Personally, I'm happy, VC and AR, that I'm part of the students who passed through your hands 10 years ago. And I'm happy to be back home. Yeah, I've not given much about myself because it is about HNMU, which is the key thing today, and which has fought. Who of you heard of the nurses' tax, stamp duty tax? They are 100. You heard of it? It is HNMU that saved you. And that's why I am saying it is not only for this quiz, but for more other important things. So we'll talk about HNMU and more of its needs when I think come in or visit with the PRO to your institutions. For now, let's focus on the quiz. Thank you very much. Oh, sorry, there is one of the judges, he had a few comments. I think, please come over. Oh, he's okay. So I think we start. The start begins with team leaders from each university. The student leaders come with a list of your team members and also select the number of set of questions you're going to answer. So the program indicates that we are beginning with anatomy, I think physiology, pharmacology, and gynecology. So we have just done a small change. We are beginning with pharmacology. Yes. Yes. Because yeah, you have some minutes to take some water, relax, come forward. So just relax. The reason is because we are beginning with, we have discussed changes which must be effected in your quizzes. You remember the different guidelines, the guidelines of last year are different from today's. So we have to take up the changes with one heart so that we achieve a good ground. So we are beginning with pharmacology. The pharmacology team will come in first. Then we can have the anatomy team, then the physiology team. Thank you very much.
The speech. Of time, in case of any discussions amongst you, let them be within the 60 seconds. We have a timer. You will hear a bell at the end of the 60 seconds to tell you that the time is up.
Yeah, 10 seconds.
Should we tell them or just suppose we ring the bell?
Okay, so you will get a warning at 10 seconds. Are we together? Left, yes. Okay. Are you ready? Are you ready? Okay. So we are going to allow you to read the question yourself. And all that time is calculated in the 60 seconds. So you read the question and answer.
Let's read the question. Yes. Yeah. Just read the question.
Time them from that.
So, sorry? Yes. When you're done reading that question, then she starts time.
Okay, so there has been agreement from the team of judges. So we shall be reading for you the question, and immediately we finish it, your timer starts. Okay. And then we do not, or let's try to avoid chorus answers from the gathering. Are we together? Okay, so let's see the correct answer. The correct answer is B, hypersensitivity. So we are going to project question 3. Remember, there are 5 questions. Question 3. The excessive stimulation of muscarinic receptors by the pilocarpine and the chronic esters is blocked competitively by.
Our answer is B, atrophy.
Okay, so let's look at the correct answer. The correct answer is B. Let's clap for them. Okay, so we are going to question number 4. Let's project question number 4. So fibrinolytic drugs are used for the following except.
Our answer is C.
Okay, so let's look at the correct answer. The correct answer is A. Okay, so we are projecting question number 5. So question number 5, which non-opioid agent is an antidepressant with analgesic activity?
Our answer is A.
Okay, so let's look at the correct answer. Yes, the correct answer is A. So those are 5 questions. Let's clap for Mooney University. Yes, I told you it's going to be an interesting one. We are all champions here. So let's wait for the next set of questions. So that's fine. Yeah. So we are going to have set number 2. That is Victoria University. Pharmacology. Victoria University. Okay, so same rules. Nothing has changed. You're going to introduce yourselves, and after that we shall start the set of questions. So each question is 60 seconds, and you'll get a warning bell, 10 minutes to the end of your time. 10 seconds to the end of your time. Is that okay? Okay, so are you ready? Yes. You can introduce yourselves as they project our questions.
My name is Seguya Ibrahim, doing BNS.
My name is Nakaketo Fiona, BNS.
My name is Hosea Tugume, doing BNS.
My name is Angusha Shakira, BNS.
Israel Peter, BNS.
Okay, thank you so much, Team Victoria. So, are you ready? Yes. Are you ready?
Yes, we
I need to feel the energy.
Yes, we are.
Okay, so question 1. Parenteral administration. Which of those is the correct answer?
Option C.
Okay, let's see the correct answer. The correct answer. There is no correct answer. Just a minute. Just a minute. Let's confirm that. It's a technical error. Our apologies. Yes, set 2. Okay, the correct answer is C. Let's clap for Victoria University. Okay, so we are projecting question number 2 right away. Question number 2, please. So a teratogenic action is Victoria University.
Option B.
Okay, let's look at the correct answer. The correct answer is B. A round of applause to Victoria University. Question 3. Indicate a muscarinic receptor blocking drug.
Option A.
Okay, let's look at the correct answer. The correct answer is A. Yes. We told you we are all champions. Question number 4. Choose the derivative of the plant foxglove.
Option B.
The correct answer is A. Okay, so one question to go. Which agent is used in management of opioid overdose? Just a health break. There's some technical errors, so let's try to rectify it before we can proceed. What is happening?
Yes, Laban is here. Yes, Joan is here.
Asime Justus.
Yes, Justus is here.
I can pray a blessing.
Oh, blessing. Okay, thank you.
Okay, thank you so much for that. So, we have 60 seconds to answer the question. I'll read it for you before you can answer. And then you'll get a reminder, 10 minutes to the end, 10 seconds to the end of your time. Are we ready? Are we ready? Okay, so let's get question number 1 projected. So, indicate the anesthetic agent of choice in a patient with liver disease. Yes. So the correct answer is C. We are going to project question number 2. Which of the following local anesthetics is a useful antiarrhythmic agent? Okay, the correct answer is B. Yo. So that is B. Okay, let's project question number 3.
It's off.
They said B. Did they say? They say?
I said B.
Okay, question 3. Which of the following agents is a ganglionic blocking drug?
Our final answer is B.
So that is correct. Let's project question number 4. Select an endocrine drug which is a steroidal derivative.
Our final answer is D.
That is correct. The correct answer is D. So the last question. So, in a patient with thromboembolism, which prophylaxis agent is commonly used and doubles as a non-narcotic analgesic?
Nitroglycerin.
The answer is aspirin. Let's clap for Team Karate. Yes, the champions. So we are all champions. So let's wait. Let's have set number 4. That is Lira University. A round of applause for Lira University as they come to the floor. Lira University.
The what?
Lira University.
We have Fiona, Bachelor of Midwifery Science.
Nakanjako Eva, midwifery year 2.
Joseph Lubwama, midwifery, year 3.
Kasekende Moses, senior student midwife, year 2.
I can do something different.
Nabukera Batanda Rebecca, year 3 midwife.
Okay, Team Lira, are you ready?
Yeah, we are ready.
Okay. Just a minute. Just a minute as we project your questions. So we are saying same rules. You will have only 60 seconds to answer every question that you have. And you'll get a warning bell, at least 10 seconds to the end of your time. Are we together? Work as a team, discuss, then you can submit your answer. So, set number 4. You can project set number 4. So question 1, which of the following drugs is used in the treatment of uterine spasms?
A.
The correct answer is C. Let's project question number 2. Which of the following agents is used as an inhalation drug in asthma?
We are giving B.
Correct. The correct answer is B. So let's project question number 3. What does pharmacokinetics include?
We are taking B.
Correct. The correct answer is B. So let's project question number 4. Okay. Tranexamic acid is an analog of aminocapronic acid. It is? Is it?
We are saying that we are taking A.
Correct. Question 5. Which non-narcotic analgesic lacks an anti-inflammatory effect?
We are taking paracetamol.
Correct. Yes. Team Lira University. Those are 5 questions. Thank you so much. Let's give them a round of applause. So we are going to have set number 5, and that is from Soroti University. Soroti University, set number 5. Let's clap for Soroti University as they get to the floor. Soroti University.
They should be a little bit far because a little bit far.
Same rules, same game. Introduce yourself so that we can confirm the participants that we have.
Oblejo, Christopher, James, 4th year. Finalist.
Limo Shedrack, BNS 4.
Faith Naijuka, BNS.
Isunga Junior, BNS.
Joel Waiswa, 4th year.
Okay, thank you so much, Team Soroti. So are you ready?
Yes.
So you have 60 seconds to answer every question that you have. And you will get a reminder 10 seconds to the end of your time. Make sure you discuss before giving your answer. So we are going to project set number 5. So which of the following agents is an alpha 1, alpha 2, beta 1, beta 2 receptor agonist?
We are going for C, which is epinephrine.
Correct. Question 2. Epinephrine is used in the treatment of all of the following disorders except
Conclusively, we are going for bronchospasm. Answer is A.
The correct answer is C. Let's see question number 3. Which of the following oral hypoglycemic drugs stimulates both synthesis and release of insulin from beta islet cells?
We are going for option D.
The correct answer is A. Let's project question number 4. So indications for calcium administration is
We go with D.
correct. Vitamin D deficiency. Question 5. Which drug can be used in management of the following situations? severe hypoglycemia, endocrine diagnosis, and beta blocker poisoning.
We have glucagon.
Correct. Clap for Team Soroti. Yes, I told you it's going to be a very tight race. And so far you can testify on that. Very, very tight. So we're going to have a short break as we prepare for the next set of questions. Just a minute. Just a few minutes. Makerere University. Let's welcome Makerere University on the podium. In the meantime, Islamic University in Uganda, you can prepare. Busitema University, you can prepare. And then Aga Khan University, you can prepare. And Mbarara University of Science and Technology. So, we have Makerere University on the floor.
Nakalembe Christine, year 2, BSN.
Chisto Frank, BSN 3.
Okenyi Innocent, BSN 3. Enoch Zua, BSN year 2.
Kamigisha Mary, BSN 2.
Okay, thank you so much, Team Makerere. Pharmacology, same rules. 60 seconds, and you get a warning at 10 seconds to the end of your time. So we are going to project your set of questions. Are you ready? Okay. Set number 6. Indicate the drug which are direct acting, both alpha and beta receptor agonist.
D.
The correct answer is A. Question number 2. Which of the following beta receptor antagonists is preferable in patients with asthma, diabetes, or peripheral vascular disease? A. The correct answer is B. Question number 3. The major mineralocorticoids are the following except
D.
Correct. Question number 4. All of the following drugs are antibiotics except
Okay, cotrimoxazole.
The correct answer is C, cotrimoxazole. Question number 5, and the last question. Which drug is the most potent diuretic?
Furosemide.
Correct. Let's clap for Team Makerere. Yes. Questions for Makerere. Now we are going to set number 7. Set number 7, that is the Islamic University in Uganda. Let's welcome Islamic University in Uganda on the floor. Yes. As Wusitema University prepares for the next set of questions. Okay, just like the previous groups, same rules. You're going to introduce yourselves so that we can be able to confirm the participants, and then we can start off.
Mutebi Rashid, BNS.
Bulage Aisha, BNS.
Zaki Mariam, BNS.
Kulabako Gloria, BNS.
Mutiogoma Jamil, BNS.
Okay, thank you so much. IU. So, we're saying same rules. 60 seconds, and you'll get a reminder. 10 seconds to the end of your time. Make sure you discuss before giving your answer. So we're going to project your set of questions. Are you ready?
Yes.
Okay, set number 7. Question 1. For digitalis-induced arrhythmias, the following drug is favored.
We take B.
The correct answer is C. Question number 2. Antibiotic inhibiting bacterial RNA synthesis is?
We take A.
The correct answer is C. Question number 3. The drug can promote sodium loss in patients with low, e.g. 40 mils per minute, glomerular filtration rates.
We take B.
The correct answer is A. Question number 4. The main mechanism of most drugs absorption in GIT tract is?
D.
The correct answer is C. Question number 5. Which route of drug administration most likely leads to the first?
Oral.
Correct. Thank you so much, the team from IUIU. So we are going to have the questions for set number 8. Okay, so it's going to be really a very tight race and an interesting one. So we have set number 8. That is from Busitema University. Let's clap for Busitema University as they get to the floor. So Busitema University, you can take the mic, introduce yourselves, so we can confirm.
Mkono Fred, BNS 2.
Apollo Sarah Patience, BNS 4.
Onyang Nicholas, BNS 4.
Victor Mdimi, BNS 3.
Apollo Faith, BNS 3.
Okay, thank you so much. So are you ready?
Yes,
So
we are ready.
60 seconds to answer every question. You'll get a reminder 10 seconds to the end of your time. Make sure you discuss before giving your answer. Okay, Busitema University, are you ready?
Yes.
Project question set number 8. Question 1. The drug is the most potent diuretic.
Our answer is A.
Correct. Question number 2. Which of the following drugs is used for systemic and deep mycotic infection treatment?
Our answer is C.
Correct. Question number 3. What is the reason of complicated penetration of some drugs through the brain-blood barrier?
The answer is C.
Correct. Question number 4. Pharmacodynamics involves the study of the following.
Our answer is A.
Correct. Question number 5. What does affinity mean?
So affinity can mean the love for something or a force of attraction towards something.
Okay, am I allowed to give another option?
Yep.
Okay, I think affinity is the ability to be attracted to something or the ability to attract something to yourself. It depends on the context you're using it.
The pre-agreed answer is a measure of how tightly a drug binds to a receptor. So I think the language misses the pharmacology language. Judges, are we together? Thank you.
Thank you so much for the clarity. Let's clap for Tim Busitema. Yes, very, very tight. Very, very tight. So we're going to have set number 9. That's from the Aga Khan University. Let's welcome Aga Khan on the floor. Team Aga Khan. Okay, so same rules. Introduce yourself so we can be able to verify, and then we can start off.
Ndagire Kuluthum.
Walulia Charles, BSN.
Muyama Sarah Rachel.
Arion Innocent, BSN.
Henry Kizito.
Okay, thank you so much, Aga Khan University. So, 60 seconds to answer every question, 10 seconds reminder before the end of your time. Make sure you discuss, you can then give your answer. So, we're going to project your set of questions, that is set number 9. Question 1. Which of the following drugs alters permeability of candida cell membranes?
Our answer is C.
Correct. Question number 2. Question number 2. Half-life doesn't depend on.
Our answer is B.
Correct. Question number 3. What phenomenon can occur in case of using a combination of drugs?
Our answer is D.
Correct. Question number 4. Local anesthetics produce.
Our answer is B.
The correct answer is D. And the last question, question number 5. If an agonist can produce maximal effect and has high efficacy, it's called?
It's a full agonist.
Correct. Let's clap for Aga Khan University. Yes. Very, very tight. So that was set number 9. So we're going to set number 11. We don't have number 10. Okay, so let's have a short break as we prepare for the next set of questions. Yes, DJ.
didn't choose the quiz. Mbarara chose. This is. Okay, BSU is set 10, Mbarara University is set 11. Let's move on. Set 10, let's start.
Okay, welcome back from that short break. We are going to continue with our quiz. Very interesting, very tight, and very hot. So, we have Bishop Stuart University, that is set number 10, after which Mbarara University should prepare. Are we together? So, same rules. Pharmacology. Bishop, so you can introduce yourself, then we can start.
Mwesiga Joa, BNS.
Angola briefing, BNS.
Ahereza Shivan, BNS 4.
Felix Tarema, BNS 3.
Another Kofi, BNS. Okay, thank you so much, BSU. So are you ready? 60 seconds to answer the questions, and then 10 seconds you'll get a reminder towards the end of your time. So, question number 1. An agonist is a substance that
B.
The correct answer is C. Question number 2. Indicate the location of M2 cholinergic receptor type.
A.
The correct answer is B. Question number 3. Sorry. The correct answer is A. Question number 3. Indicate the butyric acid derivative which has 45 days elimination half-life.
C.
Correct. Question number 4. The drug of choice for partial seizures is?
C.
Correct. And the last question, question number 5. Mention the most preferred drug of choice in grand mal epilepsy.
Fentoin.
Correct. Let's clap for BSU. Yes. As we welcome Mbarara University on the floor. Yes, let's welcome Mbarara University on the floor. Yes, very tight, very interesting, and very hot. Yeah? Mbarara University. So this is the last set of questions for pharmacology. Then we can switch over. Okay, you can introduce yourselves, then we can start.
You are Elvis, year 3.
Wilson Abonga, year 4.
Edwin Mugwanya, year 2.
Ezra J, BNS 3.
Ipangba Susan, year 3.
Okay, thank you so much, Mbarara University. 60 seconds, just like the previous teams, to answer your questions. Are you ready? Okay, set number 11. Question 1. Parasympathomimetic drugs cause?
C.
Let's confirm the correct answer.
The preset answer is D, but let's confirm. Let's move to the next. Yes. Yes. The preset answer is D, but let's confirm and come back to that.
So we shall go straight to question number 2 in the meantime. Question number 2. Indicate cholinesterase activator.
A.
Correct. Question number 3. Which stage of sleep is responsible for the incidence of dreams?
A.
Correct. Before we go to question number 4, let's refrain from any kind of chorus from the public. Is that okay? Let's try to be quiet as they answer. Yes, because it can cause cancellation. Eh? Okay.
So we go back to question number 1. Let's go back. Yes, the answer is C.
So they were correct. Okay. Question number 3. Question number 4. Which of the following anti-seizure drugs may produce teratogenicity?
D. D.
The correct answer is B. And the last question, question number 5. Which agent is a precursor of dopamine?
Erotyrosine. Erotyrosine.
The correct answer is levodopa. Let's give them a round of applause. Mbarara University. Yes, very tight. That was pharmacology. That was pharmacology. If you have any concerns, please, you can move forward here later on, and then it can be addressed. So we're going to switch over to anatomy right away. So just 1 minute, then we can start anatomy. So teams prepare. Step number 1.
anesthetics produce? A, analgesia, amnesia. Oh, you've moved away. Loss of consciousness. B, blocking pain sensation without loss of consciousness. Then C, alleviation of anxiety and pain with an altered level of consciousness. Then D, a stupor or somnolent state. I think the preset answer there was D, but the right answer was is supposed to be B. Thank you. So that's 1 point added to them. Let it be noted. Then we go to question 11, set 11. Set 11. And question 4 still. Which of the following anti-seizure drugs may produce teratogenicity? A was phenytoin, B was valproate, C was topiramate, D was all the above. And I will confirm the correct answer is all the above, D. Thank you. We can move to the next session. A point for them, noted. A point for must on that. These ones, why we do this is because if you have a complaint, you meet the desk of judges, you present a complaint there, then at the end of the session, I get to know. But what I'm trying to say is, it could be a typo, but all the other answers are right, and we confirm everything. Yes.
Okay, thank you so much for that clarification. So I hope everyone is now contented. So in case of any concern, write it down, bring it here. We shall address it at the end of the set of questions. So we shall move right away into the next set of questions, and that is anatomy. So I want representatives from every university to come and pick a paper, then we can start. One representative from every university. Let's wait. Give it to me. For set number 1. So you give the paper to Mark. Give the paper back because she does.
Where are the idiosyncrasies?
So much. So, same rules like we've said, 60 seconds to answer the questions. And you'll get a reminder 10 seconds to the end of your time. Make sure you discuss before giving your answer. Are you ready? Okay, set number one. Question one, which of the following best describes the location of the spleen?
Why is he not full?
No, please. Okay, so let's pause for a while and we change that question. Yes.
Just report at the reception. Mother Association Presidents in a minute. Thank you.
Are you ready? We are resuming afresh.
It's okay.
Question one.
It's okay.
Remember, we have the team from Mbarara University, and we are for anatomy. Okay. Project question 1. A 29-year-old woman underwent bilateral tubal ligation after her last pregnancy. During her procedure, the middle portions of both fallopian tubes were removed. Which function of the fallopian tube is not disrupted by this procedure?
B for boy.
Correct. Question number 2. Which of the following arteries is not a branch of the external carotid artery?
A for apple.
The correct answer is C. Question number 3. Which of the following muscles is not part of the rotator cuff?
E for egg.
Correct. Question number 4. What portion of the nephron extends into the medulla?
One.
Correct. Question number 5. Which cranial nerve carries parasympathetic fibers to the lacrimal glands?
A for apple.
The correct answer is D. Let's clap for Kabale University. Yes. So let's have Aga Khan University take over the floor. Aga Khan University. Introduce yourselves.
My name is Henry Kizito.
I'm Lillian Navubia.
Arion Innocent.
Waluya Charis.
Ndagire ku Lusumbu.
Okay, thank you so much, Team Aga Khan. Are you ready? 60 seconds.
Yes,
10 seconds reminder. Okay, question 1. Which of the following ligaments prevents anterior displacement of the tibia on the femur?
Our answer is E.
The correct answer is B. Question 2. What structure passes through the foramen magnum?
The answer is A.
Correct. Question number 3. Which of the following blood vessels carries oxygenated blood?
The answer is D.
Correct. Question number 4. Okay, the micturition reflex center is located in the
Our answer is 3.
Correct. Question number 5. The adductor canal contains all of the following except
I'm taking D.
Correct. Let's clap for Team Aga Khan. Yes. As Mooney University gets on the floor. Yes. Very tight. Mooney University. Let's welcome Mooney University. In the meantime, Victoria University should be preparing to get on the floor. Introduce yourselves.
Imperial MH. Year 2.
Allen Hope Pauline, year 3.
Dambia Patricia Namkwaya ya 1.
Kirao Vincent, year 2. Birungi Junior David, year 4.
Okay, thank you so much, Mooney University. Are you ready? 60 seconds for each question. Question 1. Which of the following structures is not found in the cavernous sinus?
A.
Let's confirm the answer. The correct answer is D. Question number 2. Which of the following muscles does not form part of the boundaries of the femoral triangle?
E.
Correct. Question number 3. Question number 3. The apex of the renal pelvis is called the...
Two.
Correct. Question number 4. The tuft of capillaries in the renal capsule is called the...
Two.
Let's confirm the answer. So let's confirm the answer as we move to question number 5. Question number 5. So the preset answer for question number 4, just a minute, was podocytes, but I want to confirm that. Question number 5. We are confirming the answer. Question number 5. Which of the following is not a branch of the celiac trunk?
D.
Correct. Let's clap for Team Mune University.
What was the answer?
We are going to clarify that. Okay, let's welcome Victoria University on the floor. Victoria University.
The question that was in question 4, which was asking about the tuft of capillaries, they mentioned glomerulus, and that's the right answer.
Thank you so much for the clarification. Okay, Victoria University, you can introduce yourselves.
Seguya Ibrahim, BNS.
Tumlamye Amos, BNS.
Tumwebaze Nixon, BNS.
Append Mercy Grace, BNS.
Fiona Nakaketo, BNS.
Okay. Victoria University, are you ready? Yes. 60 seconds.
Yes.
Question 1. The triangular area of the urinary bladder between the two ureters posteriorly and the urethra anteriorly is the?
Theory.
Let's confirm the answer. The answer is here. It cannot be this one. The correct answer is 5. Question 2. Which of the following structures is not part of the limbic system?
E.
The correct answer is D. Question 3. Which of the following cells are located in the retina?
D.
Correct. Question number 4. Regarding the brachial plexus, which of the following statements is accurate?
A.
The correct answer is E. Question number 5. A cornea transplant is never rejected in humans because?
C.
Correct. Let's clap for Team Victoria University. Before we invite Soroti University, we want to make this clear. Please, let's not speak answers from the congregation. It is not fair. Because if we get that again, we are going to disqualify that team. They might be penalized. People are speaking answers from the crowd. When the team is here, let's try to be very quiet. And then papers and phones, we should not bring them here. Are we together? So let's invite Soroti University for their set of questions. Soroti University. Introduce yourselves, then we can start.
Ekalu George Stephen Yafo.
Kwagala Mary, year 1.
Chapter Vincent, BNS year 3.
Faith Naijuka BNS.
Achidri Michael, year 4.
Okay. Are you ready, Soroti University? Same rules. 60 seconds, and you'll get a reminder 10 seconds to the end of your time. Question 1. Question 1. Which of the following organs is primarily retroperitoneal?
The answer is E.
Correct. Question number 2. Which of the following muscles is not innervated by the facial nerve?
The answer is B.
The correct answer is D. Question number 3. Which structure forms the medial wall of the middle ear?
The answer is B.
The preset answer is D. Question number 4. Which of the following vessels does not drain into the portal vein?
The answer is E.
Correct. Question number 5. What does the tapetum lucidum do?
C for cat.
The answer is B.
Thank you very much. Let's which question is mine? Let's welcome set 6. That is Lida University. He has gone for a short break. Are we ready?
Yeah, we
The
are ready.
rules are the same. We confirm the team being part of the preset team, the 10 members.
Lubwama Joseph, year 3.
Nanyimba Violet, year 1.
Kasekende Moses, senior student midwife, year 2.
Kemba was better known as Abdel.
We have Fiona year 2.
Are we good? Okay, so the team has been verified, and we move to set 6 of the quiz.
Are they reading for us? Or? Sir.
I'm reading. Question 1. The innermost layer and the most delicate layer of the eyeball, where the photoreceptors are located, are?
We are going with option D. D.
Yes, the right answer is D. Let's go to the next question.
Question number 2. Which of the following is not a component of the mediastinum?
So we are going with option D.
Correct. Question number 3. This is true about anterior cruciate ligament.
We are going with option 3.
Correct. Question number 4. The transmission of sound waves through the tympanic cavity of the middle ear occurs through?
We go with option 3.
Correct. Question number 5. The two sac-like structures of the inner ear called the auricle and the saccule.
We go with option E.
The correct answer is B. Thank you so much, Lira University. Yes. Let's welcome team number 7. That is Bishop Stuart University. Bishop Stuart University. You have the floor. Okay. So you can introduce yourself so we can verify the participants.
Amanya Amos, BNS.
Joab, BNS. Jordan Atumanya, BNS. Asherwa Hassan.
Okay.
Alex Tarema.
Okay, thank you so much, Team BSU. Are you ready? Same rules. 60 seconds to answer every question that you have. Okay. Question 1. Which of the following is not one of the auditory oscars?
Answer is C.
Correct. Question number 2. Middle ear infection may follow a throat infection because?
Answer is A.
The correct answer is E. Question number 3. The waxy material in the external auditory canal is the product of?
Answer is D.
Correct. Question number 4. The auricle or pinna of the outer ear contains?
Answer is B.
Correct. Question number 5. In the physiology of hearing, which action is it that generates an action potential that causes release of a neurotransmitter substance?
Answer is A.
The correct answer is C. Let's clap for BSU. Okay. We invite team number 8, that is Mbarara University of Science and Technology. Let's welcome Mbarara University on the floor.
My name is Kawaya Abdallah, BNS 4.
Edwin Mugwanya, year 2.
Tidamlala Isaac, year 1.
Segenya Murshid, year 1.2.
Nakalembe Swabra, year 2.
Okay, thank you so much, Mbarara University. As Musitema University prepares to come on the floor. So, Mbarara University, are you ready? 60 seconds. Question 1. The visible outer white surface of the eye is covered by a distinctive epithelium continuous with the inner lining of the eyelids. The epithelium is called the...
The answer is D.
Let's confirm the answer. Correct. Question 2. What structure regulates the amount of light passing to the visual receptors of the eye?
The answer is E.
Correct. Question number 3. Vision is most accurate when light rays are brought to focus on the...
The answer is A.
Correct. Question number 4. Night blindness can be treated with?
The answer is D.
Correct. Question number 5. During abdominal surgery, the nurse on duty was able to tell a loop of intestine that had protruded out of the incision that indeed it belonged to the large intestine because of?
The answer is 3.
Correct. Let's clap for... Yes. Okay, thank you so much, Mbarara University. We now invite team number 9, that is Busitema University, on the floor. In the meantime, IU, you can prepare to come after this set of questions. Okay, so we have Busitema University on floor. You can introduce yourselves, then we can start
I'm
the
St.
questions.
Peter Richard.
Kiza Luther Muke, BNS 2.
Victor Mdimi, BNS 3.
Mkono Fred, BNS 2.
Chris Pass, Jidundu, BNS 4.
Okay, 60 seconds to answer every question that you have. Question 1. Which of the following types of teeth are found in the permanent but not in the deciduous dentation?
We are going with 4.
The correct answer is 3. Question number 2. The double layer of peritoneum that covers the GIT or the GI tract is called?
We are going with 2.
Correct. Question number 3. Which of the following tissue layers in the small intestines contains the lacteals?
We are taking 1.
The correct answer is 3. Question number 4. Which of the following organs is not considered a part of the digestive system?
Our answer is 2.
Correct. Question number 5. The numerous small elevations on the surface of the tongue that support taste buds and aid in handling food are called?
We are going with 4.
Correct. Let's clap for the team. Let's clap for Busitema University. Yes. And welcome IUIU on the floor. Islamic University in Uganda. You have the floor. Okay, IUIU. Introduce yourselves, then we can get into the
Bulage
questions.
Aisha BNS. Judith Alum BNS. Makintu Alice BNS. Yafo.
Utata Tribe, BNS.
Mtiogoma Jamil.
Okay, thank you so much. 60 seconds for every question, and you get a reminder 10 seconds before the end of your time. Question 1. Stenosis or constriction of the sphincter of ampulla would interfere with
One.
Correct. Question 2. The first organ to receive the blood-borne products of digestion is?
Okay, the liver.
Correct. Question number 3. The elastic tissue connecting the chorda epididymis to the scrotal sac is?
We take A.
The correct answer is C. Question number 4. By the contraction of the spermatic cord, the testes of man are not taken to the abdominal cavity due to this structure.
We take B.
The correct answer is B. Question number 4. Now, question number 4. The cells of the testis secrete testosterone. These cells of the testis secrete testosterone.
We take C.
Correct. Thank you so much, the team from IUIU. We still want to caution you, please, please. When a team is here presenting, let's try to be quiet. Because we might disqualify a team because of something that can come out of the crowd. Okay, thank you so much, the team from IUIU. So now we invite team number 11, and that is Makerere University. Makerere University on the floor. Let's welcome Makerere University. You're so stubborn.
Chisto Frank, BSN 3.
Nakalembe Christine, Year 2 BSN.
Muska Gideon.
Kemigisha Mary.
Nansamba Esther Catherine.
Okay, thank you so much, Makerere University. 60 seconds for every question, and you'll be reminded 10 seconds to the end of your time. Are you ready? Question 1. Seminiferous tubules develop central lumen. Seminiferous tubules develop central lumen after
puberty.
Correct. Question 2. Another name for bulbourethral gland is?
Corpus glands.
Correct. Question number 3. The right testicular vein drains into which vesicular structure?
Inferior vena cava.
Let's confirm the answer. So let's proceed to question number 4 as we confirm the answer to that. Question number 4. The left testicular vein drains into which vesicular structure?
C.
Correct. Question number 5. Branches of the internal iliac arteries supply blood to all of the following except?
A.
The correct answer is B. Thank you, Makerere University. Yes, I told you it will be very tight and very hot. Okay. Okay, let's confirm the answer to the previous question, then we can get back to you.
Meanwhile, as they are preparing to confirm, congratulate yourselves. All participants, let's appreciate them. Thank you. And let us also appreciate these people who are taking us through. They are doing a great job. And if at all there is anyone with a complaint, please bring it up to the panel so that we can get to it.
The team which answered question 3, the right testicular vein drains into which vesicular structure? A, inferior vena cava, B, superior vena cava, right renal vein, then D, pampiniform plexus. So the right answer is A.
All right, thank you very much. So up next is a lunch break. But this is what we are going to follow for lunch break. We are going to allow participants first so that they can prepare for the upcoming session. You understand? Participants first so that you can come quickly and prepare. But as you're going, ask your neighbor, does the pressure increase or it decreases? It is doing what? All right, let's break off for lunch. See you later. Thank you. Shortly.
A disclaimer to the team. So far, thank you for the cooperation. Anything that you might find not clear, it's just a typo. Make sure you clarify with the desk. Thank you very much.
Okay, so the staff members, those who escorted the students, we are going to use the upper room where you had breakfast. Then the ushers, please come forward and guide the teams. I hope the members responsible have given the coupons for the respective institutions. So without wasting time, ushers, you can come forward and guide the people where they are going to have their lunch. But it is not in good faith when we don't pray for our lunch. So I'm going to take the lead just in a minute and then we go for lunch. So let's humble ourselves for our lunch. Father, in the mighty name of King of Glory, we thank you, Lord, for the time we have spent here and that you are still gathering us under your strong hand. May you continuously bless the lunch that we are going to take and let it be of good value to our body. And we shall always thank you, Lord, once we win whatever is on our side, Lord, that we shall always come here to give glory to your name, for you have always been with us. We thank you so far for the phase we have finished. And Father, we call upon you to guide us in the next phase that we are going to do. We believe, we trust your Son, Jesus Christ. Amen. So, nice lunch. We are all going to be guided by the ushers. For our good friends, the Muslim community, those who want to have prayers for the...
Representatives from all the teams, you can come and pick your numbers. Make sure you put it. You give me the paper after choosing and you write here.
So you look at it. I have when you look at the bank says
So Mbarara University, prepare to come for set number 1.
You can give me the papers after writing.
Mbarara University, prepare to come for the first set of questions. Mbarara University, prepare to come for the first set of questions.
When you have physiology, what do you have in there? Which other one do you have?
Okay. Let's invite the first team, that is from Mbarara University.
You confirm with the lecturers, and then we agree. You can show them this. Sorry. That's what I'm trying to do now. These guys have interrupted me immediately after that.
My name is Kawaya Abdallah, BNS 4.
Segenya Murshid, BNS 1.2.
Tidamlala Isaac, BNS 1.
Nakalembe Swabra, year 2.
Edwin Mugwanya, year 2.
Are they all here? No. You can repeat. Is it? Apologies, she needs to confirm.
Edwin Mugwanya, year 2. Edwin Mugwanya.
Nakalembe Swabra, year 2.
Tidamlala Isaac, year 1.
Segenya Murshid, year 1.
Kawaya Abdallah, year 4.
Team, you're welcome from the lunch break. I don't know if it is the lunch break. So far, we're done. Let's keep moving. Maybe tomorrow will be a bit faster. We got concerns. We are finalizing concerns of pharmacology. So about pharmacology, I think 2 more came in about idiosyncrasy and hypersensitivity. And I think, okay, you project. Let him project for us the pharmacology. Set 1, I think question 2. Pharmacology, set 1, question 2. Because I think all pharmacology questions will be answered. one short answer. So, oh, it's not projected, but I can read the question, isn't it? You want it projected? You don't want anything? Okay, because everything is no. But we need to finalize and we go to the next quiz. Time is fast spent. Now some of us are losing the professionalism. But let's be patient. We get the answers, and then we move. And for the matter of time, the question was saying, characteristic of unwanted reaction which isn't related to a dose or to a pharmacodynamic property of a drug is called A, idiosyncrasy, B, hypersensitivity, C, tolerance, D, teratogenic action. So according to my preset answer in the back, it was showing hypersensitivity. However, the team that presented idiosyncrasy. So when you again internalize the question, you will see that this, it's an unwanted reaction that isn't related to a dose. Are we clear? And also not related to pharmacodynamic property of a drug. So in clinical trials, most of the times, based on my experience, at least I'm confident to rely on it. Usually, hypersensitivity is having a relationship to the drug. Do we agree? And of course, tolerance is a whole new thing out of this league. So we may not consider that. Teratogenic effect, we all know these are fetal effects. So I think the answer, as the team had mentioned, regardless of the preset answer, is idiosyncrasy. Yes, you have a proposal? What? What is? So the team is questioning what they also believe that hypersensitivity. Okay, let's take common examples. Let's look at hypersensitivity in reaction, in how it happens. So how do we say someone is hypersensitive to something? Because now that's why I want the lecturers and the team to come in. How do you call, when is someone hypersensitive to something? It's either having got a certain dose or exposure to that. Are we together? It is related to a certain dose or to the effect of that. You feel it is not? Let's have lecturers, I think, discuss this. The good thing that table is, if you feel it is not, but to me, I think idiosyncrasy makes it more clear compared to hypersensitivity. So Makerere is contesting. Should we have someone who can explain? Yes? You want to explain your answer? Please. The good thing we are scientists.
Good evening, colleagues. According to that question, my answer would be hypersensitivity. That is because the first answer is related to the PD of the drug. That's the drug action. But hypersensitivity can be any foreign body in your system. The body can react to it. I think maybe that's where I was not sure.
So idiosyncrasy, he says it is related to the pharmacodynamics, but it is not. I think that should be clear. Let's have it clear in our thinking. And I am saying, in case lecturers we are here, what is your say? Because for me, I am basing on my experience of drug development. I have been in that area for more than 4 years. And I've had at least enough time to write protocols on that. So I don't know you, where you're basing, but it's fine. I want us to agree so that we are free on that issue. It's mainly a matter of understanding idiosyncrasy and hypersensitivity. Okay, so this one has been pushed to next day. We will come back to that. Let's not waste time about it. The next question, which was in contention, is in pharmacology No, this is anatomy. Anatomy will handle it separate. Let's first finish pharmacology. No, this is anatomy. The agonist, yes. Which university was that? That was VSU. The question was, are we connected? Here we are. That was set what? Set? So set 10, question number 1, was saying an agonist is a substance that A, interacts with the receptor without producing any effect. Listen well, an agonist is a substance that interacts with the receptor without producing any effect. To me, that one is automatically wrong. B, interacts with the receptor and initiates changes in cell function, producing various effects. To me, that is the most appropriate answer. C, increases concentration of another substance to produce effect. I think we have a different term for something that increases concentration of another. So I would not take that for the agonist. Interacts with plasma proteins and doesn't produce any effect. That is completely wrong. So from the writing, I think she had copied C, but the answer is B. I confirmed with my bank, the question bank, and it is the same answer I have in the bank. And of course, that's why I say any error is either a typo, clarify. But we are here to talk science, and we are going to discuss science. Yeah. No confusing each other. Idiosyncrasy for tomorrow together with hypersensitivity. Thank you very much. For anatomy, we've not handled your issues yet.
Okay, thank you so much for that clarification. So as we wait for the projection of our questions, just a heads up.
So that means that the theme of set 10, that's BSU, the agonist, have a point. We should mark that and put it there. The theme of hypersensitivity, we are going to clarify by tomorrow. Let it be our homework. Thank you.
Thank you so much. As we prepare for the next set of questions, just a heads up. We are going for physiology, and it's going to be strictly structured. We don't have any MCQs for physiology. So, make sure you read, internalize the question, discuss, then you give us the answer. And yes. So, in 1 minute, 60 seconds. Okay. That's it for me. Any other? So let's prepare.
But then here it was C, which was wrong the time before the time. So the answer, yes, it is the type. So that one I accept, but what I don't accept is the, even if hypersensitivity is something I am still questioning. So we had agreed one. Yeah, we had agreed one. I think let's maintain one so I can let's put one. If we multiply, we multiply. Yeah. I think we're doing physiology and going home. It is getting to 7. So we do 4. The good thing here it is 1-1. So at the time of when you're reading the question, it will be part of the what?
But we are not we have good time.
So after here we should step back and change some of the automatically they have to come early. Again, you come late, you'll find when people have picked, and when they pick and you don't pick, then you lose the marks. That one should not be there.
Okay. So, as Mbarara University gets ready, we shall have IUIU next, and then we shall have Kabare University in position number 3. Okay. Mbarara University. Are you ready? Are you ready? Okay. We said we are going to be doing structured questions. So you need to really discuss amongst you and make sure what you're giving, you're confident about it. Okay. So let's have the timekeeper. Are you ready? Question number 1. Question 1. Most cells, excluding fat cells, are primarily composed of
The answer is what?
Correct. Question number 2. Question number 2. Which organelle neutralizes drugs and toxins?
The answer is peroxisomes.
Correct. Question number 3. Hair cells in the cochlea detect
The answer is vibrations.
Let's confirm the answer. Let's go to question number 4. Testosterone is produced by
The preset answer for question which has gone is sound frequency. So we say that we wait and then I confirm.
The answer is Leydig cells.
Correct. Question number 5. What protects the duodenum from gastric acid?
The answer is mucus.
The correct answer is pancreatic bicarbonate secretion. Yes. Let's clap for Mbarara University. On the floor, next we have IUIU. The pressure is increasing. Eh? Okay, IUIU, you have the floor.
Let me just.
You can introduce yourselves.
Kulabako Gloria, BNS.
Judith Alum, BNS.
Ntyogoma Jamil, BNS.
Makintu Alice, BNS.
Montebi Rashid, BNS.
Okay, thank you so much, IUIU. Are you ready? 60 seconds, and you'll get a reminder, 10 seconds towards the end of your time. Slide number 1. The most abundant cell membrane lipids are
Phospholipids.
correct. Question number 2. The first stage of mitosis is
The answer is interphase.
prophase is the answer. Question number 3. Rhodopsin is found in
the answer is rods in the eye.
correct. Question number 4. Oxytocin stimulates
The answer is uterine constriction.
Contraction.
Contraction.
correct. Okay, so we go to as we wait for the last question. Six seconds to answer the question. Okay, so let's go to question number 5. Yeah, they passed.
Okay, they passed.
Let's go to question number 5. Question number 5. Which cells secrete gastric acid?
The answer is G cells.
What?
The preset answer is parietal cells or exentic cells. So you see,
If not parietal, the other name is opposyntic cells.
a round of applause for IOIU. Let's have the team from Cabaret University.
As the team comes, we've discussed the question of order. House, let's have order, please. Thank you. Thank you. Hello. Okay, thank you very much. So, the discussion we've had is about the cochlea, the hair cells in the cochlea. if I recall the question well, detect. And of course, the team gave vibrations. I partly agree that vibrations are part of the process, but the most and the key appropriate answer is sound frequency. So we are sorry, the set rules say it's a point or a 0. That's why we failed to give you a point. Thank you very much.
Thank you for that clarification. So let's have the cabaret team introduce themselves.
Mbarara Abi.
Nabasa Elia.
Anyango Lorraine.
President Manuel.
Kusonga Laban.
Okay. 60 seconds to answer the question, and you'll get a reminder, 10 seconds to the end of your time. So let's have question number 1. Telomeres are located at
The answer is the chiasma.
The correct answer is chromatid ends. Question number 2. Extracellular fluid has higher concentrations of which electrolytes?
Sodium ions.
The answer is sodium and chloride ions.
But the most abundant in the sodium ions.
So you earn a point for that. Question number 3. Hyperbaric oxygen therapy treats
I'll take lung collapse.
The correct answer is carbon monoxide poisoning. Question number 4. Gonadotropin releasing hormone is secreted by
The hypothalamus.
Correct. Question number 5. Which organ has the highest arteriovenous oxygen difference at rest?
The lungs.
The correct answer is the heart. Let's clap for Team Kabale. Okay, so
More to that, the myocardium extracts 70 to 80% of oxygen from blood, a reason as to why the heart is the best answer. Thank you.
okay, thank you for that clarification. So let's have the next team on the floor, that is BSU. Let's welcome BSU. BSU team. Let's welcome Bishop Stuart University. In the meantime, Mbarara University should prepare to come next. So you can introduce yourself so we can verify.
Still Ashawa Hebwasan.
Muntu Boaz.
Mwesiga Joab.
Felix Tarium. Ankunda Griffin.
Okay. 60 seconds to answer every question. Remember, they're structured questions. And you get a reminder 10 seconds to the end of your time. So make sure you discuss before giving your answer. Question 1. Carbon dioxide is primarily transported as?
Hydrogen carbonate ions.
We have bicarbonate. So you get a point for that. Question number 2. Aortic regurgitation increases.
It increases heart, rather blood pressure.
The correct answer is pulse pressures. Question number 3. During the absolute refractory period, a stimulus causes
The stimulus will not cause any effect. Will not cause any effect in the nerve.
No action potential caused. You earn a point for that. Question number 4. Normal serum sodium is?
Give that range.
135 to 145.
Correct. Question number 5. Which cardiac structure has the fastest conduction velocity?
Sinoarterial node.
The answer is Purkinje fibers. Let's give a round of applause. Thank you, Kawara University. BSU University. So let's invite Makerere University.
Nakalembe Christine, BSN, Year 2.
Nesamba Esther Catherine, Binar, Year 1.
Chisto Frank, BSN 3.
Okay, Innocent.
Gideon Muska.
Okay. Welcome, Makerere University. Are you firm? Are you ready? Okay, 60 seconds. Question number 1. Exercise-induced vasodilation is due to?
Byproducts of metabolism and heat loss.
The correct answer is decreased tissue pH and increased bicarbonate ions. Increased what? Increased carbon dioxide. Okay, let's go to question number 2. Surfactant reduces?
Surface tension.
Surface tension in the lungs.
Correct. Question number 3. The cerebellum coordinates?
Okay, so motor coordination, we have balance, posture.
The preset answer is voluntary movements. You can note that down, we shall clarify. Question number 4. Question number 4. Normal pH ranges is?
7.35 to 7.45.
Correct. Question number 5. Which heart sound is associated with turbulent blood flow during ventricular filling?
S3.
Correct. Let's clap for Mbarara University. These questions are going to be clarified on.
What has happened? What has happened? Two questions. Yes.
Sorry. So here, we talked about balance and which is correct. And even here, carbon dioxide is a byproduct, which are also correct.
Exercise-induced vasodilation is due to, they said what?
Product cells, metabolic wise, and again, let me give an example.
And then let's go back to the questions for Makerere. We are having a challenge of unclear answers, and that puts the quality of the quiz low. So what we are considering now from the discussion I've had with judges is that we are going to award specific answers, mainly the more clear answers are going to get the marks. So like we said, so let's go to the Makerere quiz. Let's go to the Makerere quiz. I think that's where we are. We'll finally agree. Question 1. Exercise. Let the team come back. Yeah. The Makerere team, let's be back. Thank you. So we've said this was the, what was the answer here? Okay, here they mentioned S3, and I agree. The third heart sound often is the one associated with the turbulent blood flow during ventricular feeding, and of course in adults it's pathologic. So they have the point. Is the clarification you wanted? No. They gave S3. Okay. Okay. Exercise-induced vasodilation. I think I'm reading something wrong. Exercise-induced vasodilation is due to, you said?
Metabolites and heat production. Byproducts of metabolism and heat production.
For example?
Yes, I said heat.
Okay, for example?
The carbon dioxide is a byproduct of metabolism. Lactic acid is a byproduct of metabolism.
So the answer is increased CO2 and reduced tissue pH. So if they have mentioned byproducts of metabolism and they have mentioned CO2, they are more clear. The question here is, have they changed the answer or no? So they mentioned products of metabolism, and that's why I had to ask to clarify, and they have given the answer. Okay, Makerere is going to have another question. Let the judges communicate what we have decided.
Hello. Some order. Colleagues, some attention. I would wish that we exercise some kind of maturity in this, and let's not, no, wait. I'm requesting all of us to be calm. Yes? I want all of us to be calm, and then we make it balanced. All the questions that I've said here, some people get hard questions, some people get soft questions, some people get what? Now, this is what I want to say. This is what I want to say as a judge here, that you've given a chance to actually listen to your answers. That we are going to give Makerere another chance to actually another set of questions. That's what I'm meant to mean. Okay, let's make it like this. The question where we have contention, we shall substitute that question. Members, we still have a long way to go, and we still have many more questions. Let's move on, and then we shall revisit this.
Okay, thank you very much. We are out of time, and thank you for the order. Makerere, you can go and sit. You'll be called after. What's the issue with number 3? So number 3, let's go to number 3. Number 3, what was number 3? The correct answer for number 3 is voluntary movements. Did they say voluntary movements? If they didn't say voluntary movements, then we are out.
Hello? Members, let us listen for one reason. Let us listen for one reason. I can see hands which are up. That is very okay. Let us listen. Let us listen. Let us listen, members. Okay? Now, there is one item which is going on. One is that let the table of judges first agree on one thing, and then, all together, there are complaints of the team which has just finished, and then there are complaints from the other participants, okay? We are going to listen to every complaint. That is it. All together. Every complaint must be listened. But if we shout from different sections, then we shall not move forward very well. So each institution now, all together, you have a representative, okay? Let that representative move to the table of judges. They bring a complaint of the group. Because if we speak from different corners, we shall not pick them. So for example, this is from Makerere. They can have a person who can come quietly. He comes. Okay. As we have agreed all together that the queries must be listened to. That is the position. That every inquiry from any institution must be listened to maximally, but not by shouting from the corridors. All together. Like I said, they will continue. You bring the query to the table of judges. All together. Yes. So let them give us the...
Excuse me, colleagues. Excuse me. Colleagues, excuse me. Let's have the judge give us the position, because we have agreed on a position, because we have something in the house. So let him give us the position that all of us will agreed, not all of us. Can you communicate the entire?
Hello, members. You will give us time. This presentation that is going on, it's on a recording. So we shall be able to get that specific part and then listen to the recording and actually say whether our colleagues mentioned what they are saying. Thank you.
Okay, thank you so much, our judges, for that clarification about Makerere. So we shall get the answers at the end. So at this point in time, let's invite the next team, that is Busitema University. Busitema University. Thank you so much. Okay, so as we wait for the team from Busitema to get on the floor, given the previous circumstances, we urge you to be very audible and clear with your answers to avoid any ambiguity. Are we together? Make sure you're audible enough and you're very clear. Okay, introduce yourselves so we can be able to verify you.
Apollo Faith, BNS.
Kiza Luther Muke, BNS2.
Mkono Fred, BNS2.
Sabato George William, third year.
Answer wa Faith, BNS.
Okay, so Busitema team, are you ready? Structured questions, 60 seconds.
Yes, we are ready.
Okay, so can we have total silence so that we can be able to hear what is coming out from our team? I'm kindly requesting that we all have total silence. Okay, question 1. Nitric oxide release is stimulated by?
It is stimulated by an increased hypertension.
The correct answer is shear stress. Question 2. Intrinsic coagulation pathway involves which factor?
Factor 12.
Correct. Question number 3. Parkinson's disease involves loss of which neurons?
Dopaminergic neurons.
Correct. Question number 4. Hematocrit in adult males is?
%.
The correct answer is 40 to 50%.
45%.
We shall clarify that at the end. Question number 5. What effect does increased vagal stimulation have on heart rate?
It slows down the heart rate. Or decreases the heart rate.
Let's confirm the answer.
It slows or decreases the heart rate.
Correct. Let's clap for the team from Busitema.
What about the other one?
We are clarifying. Thank you so much.
Thank you.
The one 45.
So let's invite the next team on stage. That is Soroti University. Soroti University. Let's welcome the team from Soroti University. Okay, you can introduce yourselves, and then we can start.
Archidri Michael.
Ekalu George Stephen. Bisunga Junior.
Kwagala Mary.
Joel Waiswa.
Okay, so Team Soroti, we have 5 questions for you, 60 seconds each, and you're required to discuss before giving your answer. Okay, are you ready? Question 1. Angiotensin 2 increases blood pressure via
Angiotensin stimulates aldosterone release, which causes reabsorption of sodium ions and water. It also induces vasoconstriction. Therefore, the two processes result in increase in blood pressure.
Okay, let's verify the answer.
The answer is vasoconstriction. Oh, and aldosterone. What they mentioned is, no. They have said that it will lead to vasoconstriction leading to high blood pressure. Did I listen well? And I have told you the answer is vasoconstriction and aldosterone.
Yes, we mentioned them. We mentioned aldosterone.
So they take a mark.
Question 2. Question 2. Intrinsic coagulation pathway involves
Factor 12.
No, we are giving them another question for that. Yes, you have one more question. So you go relax, you'll come back for that. Thank you. It was your question 1. It was number 2. Oh, okay. Then it's okay. We'll move to the next. Make sure we don't have.
Our set is 7.
Hey, you are. Relax, relax. No, no, no. It is not about.
Okay, sorry for the inconveniences. We're back to Soroti University. Make sure it's not. Question 2. Alpha motor neurons innervate which fibers?
Skeletal muscle fibers.
No, the correct answer is extrafusal fibers. Question number 3. Muscle spindles detect
Proprioception. Proprioception. Proprioception.
proprioception. The preset answer is muscle stretch. Correct. Question number 4. Normal fasting glucose is?
$70 to 100 milligrams per deciliter.
Correct. Question number 5. During which phase of the cardiac cycle is the aortic valve open?
Systolic phase.
Correct. Let's clap for Soroti University as we welcome Victoria University on the floor. Victoria University.
Okay, leave it because they are going
Okay, introduce yourselves, and then we can start.
Seguya Ibrahim, BNS.
BNS, Israel Peter.
Nakaketo Fiona, BNS.
Angusha Shakira, BNS.
Hosea Tugume, BNS.
Okay, so Victoria University, you have 5 questions. Make sure to discuss before giving your answer. Question number 1. Pulse pressure is increased by?
Stroke volume.
The preset answer is increased stroke volume. So, no, increased. They just said stroke volume. That's wrong. Okay. Okay. Let's clarify that answer. Question number 2. Platelet adhesion requires which factor?
Factor 7.
Let's confirm the answer. So the correct answer is the von Willebrand factor. Question number 3. Pepsinogen is secreted by? Time up. The correct answer was chief cells. Question number 4. They didn't... Question number 4. No more creatinine clearance is?
8.5 to 10.5.
The correct answer is 90 to 120 milliliters per minute. That's wrong. Question number 5. Which ECG finding indicates a first-degree heart block?
Elevated P wave.
No, the correct answer is the prolonged PR interval. Thank you so much, the team from Victoria University. Let's welcome the team from Lira University. Lira University, you have the floor.
About the question of factor 7. Hello. About the question of factor 7. The right answer is factor 8, Van Willebrand factor.
Okay, thank you so much for that clarification. You can introduce yourself so we can be able to verify you.
Ivana Kanjako, year 2 midwifery.
Nanyimba Violet, year 1 student.
Fiona Wieha, BCM, BSM, year 2.
Kemba was parent, midwifery, year 1.
Kasekene Moses, senior student midwife, year 2.
Okay, so Lira University, 5 questions, 60 seconds each. Question 1. Mean systemic filling pressure is elevated by?
The answer is increased venous return.
No, the correct answer is sympathetic stimulation. Question number 2. Erythropoietin is produced by?
The answer is the kidney.
Correct. Question number 3. Bile salts emulsify?
The answer is fats.
Correct. Question number 4. Strength training increases?
The answer is muscle mass.
Correct. Question number 5. Inactivation of sodium channels during an action potential contributes to which phase?
The answer is repolarization.
No, the correct answer is refractory period. So if you have any concern on the question, we can clarify on the answer. Thank you so much, the team from Lira University. Let's clarify on that answer. Okay, we are going to clarify on question number 5 for Lira University. So let's invite the next team, Aga Khan University.
This is wrong. An activation of certain unique and active potential. Let's check what is what.
My name is Henry Kizito.
Okay.
Ndagire Kuruthum.
Waluya Charles.
Arion Innocent is my name.
Mia Masar Rachel.
Okay, thank you so much, Aga Khan University. 5 questions, same rules. 60 seconds. Question 1. Cardiogenic shock is treated with?
Our answer is digoxin.
No, the correct answer is volume expanders. Question 2. Hyperkalemia causes?
Cardiac arrhythmias.
The preset answer is membrane depolarization. Correct. Question number 3. Iron absorption occurs in which part of the digestive system?
Duodenum.
Correct. Question number 4. Question number 4. Delayed onset muscle soreness is due to
Tissue hypoxia.
No, the correct answer is micro tears in muscle fibers. Question number 5. What is the primary function of the sodium potassium ATPase pump?
Yes, I know it has
Active transport.
The preset answer is to maintain the sodium and potassium concentration gradients across the cell membrane. We are going to clarify the answer.
The answer is clear and it has been mentioned and we didn't get the answer. Thank you.
Thank you, Team Aga Khan. So we have the last team of the day. Team number 11 from Moni University. Let's welcome Team Moni University. Okay, so Moni University, introduce yourselves and we can get into the questions.
Imperial Amek.
Okello Boniface.
Damia Patricia Namkwaya.
Vincent Shirao. Birungi Junior David.
Okay, 5 questions, 60 seconds each question. Question number 1, the glomerular filtrate rate is regulated by
Blood flow the glomerulus. Blood flow the glomerulus.
The preset answer is the afferent arterial resistance. Wrong. Question number 2. Renin is released in response to
Decrease the arterial pressure.
The correct answer is reduced renal perfusion pressures.
I say reduced arterial pressure.
So we're going to clarify on that answer. Question number 3. Let's first clarify on that. Question number 3. What does insulin decrease?
Blood glucose levels.
Correct. Question number 4. Which nutrient is absorbed via the facilitated diffusion in the small intestine?
Glucose.
We're clarifying the answer. So what have you agreed? We are okay, let's go. Let's clarify on that answer. Let's do the last question. Correct. Let's clarify on that answer. Question number 5, and that's the last question. During the upstroke of a nerve action potential, which ion channel opens?
Sodium ion channels.
So the correct answer is the voltage-gated sodium channels, which is
Sodium ion channels.
correct. Thank you so much, the team from Muni University. Let's
Yeah.
clarify on the questions that had.
So they take the glucose mark for question number 4. Let's check the question number 4. So the decision has been taken by judges, and by the powers entrusted in them, we have agreed it's their point. Thank you.
Sir, how about renin? Renin. Renin. Renin.
What?
For renin.
We are seeing it. I think they take the answer, it's right. They said what? No, that one we finished. We are not discussing glucose. We finished that one. We are discussing about the channels. Hey, you people, what are we discussing? No, glucose, we are past that one. Yeah. Let's have the team from Makerere. They have a question. One question, and I think that's the team. Is there another team? The what?
Victoria 0, Kabari 10, Soroti 15,
Soroti 20.
So what time are we meeting here tomorrow? So what are we telling them now? What should I communicate to them? What should I communicate?
8 is reporting, then you can judge between them.
8 should not be reported. When you told us to come here at 8, tell them to report at 7 so that before they report at 8, you
Fine, it is fine.
everything shall be clarified all time. Time has gone.
Hello, members. I just want to take this opportunity to thank everyone who has participated. I want to thank all the brains that who have celebrated their, can I say, their abilities here. So the day has come to an end. I believe it has been a hectic one. There are lows and highs, but probably tomorrow we shall all be high. That said, of course, always the best person will win, right? The winner will always win. So, and I also wish that the winner wins. We are to leave this house now. There is an activity for the school that is going to take place. So we are all requested to leave to our places of residence where we are going to rest. Then tomorrow, we are all expected to be here by 7:30, and then we shall kickstart. Tomorrow, I believe there are no new guests that we may receive that will prolong their conversations or the speeches. So we expect that by 8:30, actually 8, yes? By 8, we should be rolling the ball in front here. So that said, I want to wish all of you a blessed night and a good morning tomorrow. Probably somebody say the concluding prayer. Maybe before we say the last prayer, we have taken note of all your written concerns. We have them here. We are going to respond to them tomorrow. Because we do not have enough time to respond now, we are pushing it to tomorrow. So probably the first thing that we shall do is to respond to these concerns. Okay? Okay, all right. So there are still more pieces of communications. probably bear with us and spend 1 or 2 minutes. Okay, thank you.
Hello?